Vayayanam, Namo Uvachayanam, Namo Voe Savasahulam, Eso Panchanamokaro, Savapavanasanam, Mangalam Chisarvesam, Vatamam Havai Mangalam, Vatamam Havai Mangalam. Jai Jinendra, Namaskar. Thank you so much for joining us today. A happy new year and best wishes for 2021. JITO Women's Forum and Kalpana ji from Jain Center of America are delighted to hold this health seminar about COVID-19. I know last year has been particularly tough for all. Hopefully, this year, 2021, we should hold more events like these as we had previously planned. JITO New York Women's Forum aims to provide a platform for all women from different walks of life to showcase their ability and share their trials and tribulations. JITO Women's Forum creates a platform where we can learn from each other and empower each other to strive for better. We can channel our energy to create a bright future for our younger generation and socially elevate others who don't have the means. It is, it is becoming evident that we need to be technologically savvy and take on leadership roles to strengthen ourselves. It is impressive today that 13 women of Indian origin are in key position in Biden-Kamala Harris administration, a record for the small ethnic community that constitutes 1% of America's population. Even more impressive is that so many women within our Jain community have taken entrepreneurs' roles in top-notch companies. They are running their businesses and at the same time taking care of their loved ones. Cheers to all the women here today. However, our responsibility is to help our young entrepreneurs build a pathway to interact and learn from our established business leaders' experiences. To succeed, we will need to collectively and positively participate and contribute to the Women's Forum to reach heights that will change every woman's life. Behind every successful woman, there is a tribe of other successful women. Success is never reached alone, and wisdom and wealth are sweeter when shared. The JITO women are ever so ready and available to take on such a responsibility. Because of this attitude, JITO Women's Forum has been gaining many strides all over the world. Due to COVID, we have been isolated in our homes and away from our loved ones. Hopefully, this is a light at the end of the tunnel now that we have the available vaccines. Despite this, we all still need to be careful. We still need to be aware of what it is, who and where to seek help, and how to protect ourselves and others. We are excited to have these lovely doctors shed some lights on this topic. Thank you. I will hand over the mic to Ruchiji Kothari, who has been instrumental today to help us coordinate the program. Ruchiji.
Thank you, Prabhaji. I don't think any one of us ever imagined our lives to change so drastically as it has because of the COVID-19 pandemic, affecting every which way we interact personally and professionally. The COVID-19 virus has torn families apart, while it has also brought families together. Unfortunately, because of it, we've lost dear ones from the community, as well as we've welcomed new ones. Even though we have all adapted to the new normal with the COVID-19, many questions still remain unanswered. And this is what our webinar is about today, COVID-19. It is an honor for JITO USA New York Women's Forum to have 3 distinguished medical practitioners volunteer their time to talk to us about the COVID-19 virus, vaccination, and answer the many questions we may have. First of all, we want to thank and applaud our panelists and all medical professionals and frontline workers for their selfless dedication to humanity. Thank you so much. Real quick, before I hand over the webinar to these esteemed medical practitioners, let me explain the format of the webinar. We'll start with Dr. Nilesh G. Mehta with an overview of COVID. Then Dr. Nanda G. Ramsarup will discuss COVID-19 symptoms, when and where to seek attention. And finally, Dr. Rekha G. Bandari will provide us the ABCs of the COVID-19 vaccination. Each speaker will have 20 minutes to speak. We have reserved the last part of the webinar for an opportunity to ask questions after all 3 panelists have spoken. So remember to keep your questions ready. I'm about to share my screen. Okay, without further ado, let me introduce you to our first panelist, Dr. Nilesh G. Mehta. Dr. Mehta received his MBBS from Mahatma Gandhi Memorial Medical College in Indore, India in 1998. He then went on to complete numerous internships, fellowships, and residency at many university hospitals, including residency in internal medicine at the Columbia University College of Physicians and Surgeons in 2004, and a clinical fellowship in gastroenterology and hepatology, State University in Syracuse, New York in 2006. An industry expert, Dr. Mehta has published over 40 research papers and received considerable acknowledgement in his field. Dr. Mehta has been affiliated with many New York area hospitals, including New York Presbyterian Queens, Northwell Health North Shore, and Long Island, and Flushing Hospital Medical Center. Currently, Dr. Mehta serves as a medical director at Northeast Endoscopy and New Hyde Park Endoscopy. He is the president, CEO, and attending physician of Digestive Disease Care, a state-of-the-art facility in gastroenterology and hepatology. Now, let's welcome Dr. Nilesh G. Mehta.
Jai Jinendra. Ruchiji, thank you so much for the kind words. Jai Jinendra to everybody, and thank you so much for joining us on today's webinar. This is a very common topic, something that we are all familiar with and all excited because we see the change coming soon. And I'll go through some of the simple things and ideas that we probably know about, but they're important to understand because from a future perspective, we still need to know what this is and how this can impact our lives if you don't follow some simple rules, at least for the coming year. This in a way kind of reminds me of the flu vaccine, the flu where people get sick every year. There's a new strain coming up, but we'll talk more about the vaccine when Rekhaji touches the topic. But I'm sure all of us are very excited because hopefully this will be the end of webinars and we'll soon have face-to-face meetings. I'll try to share my presentation so you can look at it. Give me 1 second. I'm just trying to understand if you can you view the presentation now, Ruchiji?
Yes, we can view it. If you can show the main screen.
I'm
Just
I'm having a hard time understanding what is being shown because
There's
I
a present mode on top of the share screen. Do you see the present mode? It's like the third button to the right.
okay, come here. One second. Here. As you know, my kids are probably more savvy sitting at home doing homeschooling.
So, which
I
one?
wanted this presentation.
This
one?
Same.
No,
Yeah.
there's a present mode next to share. Do you
That better?
see present on top?
Better?
Is that better?
It's
Sure. There's it. I believe the present mode has still not been pressed. Do you see the share button, which is yellow? It's in the right corner. Move to the right. Yep. And right next to it is present. Don't press share.
This one, present.
Yes.
Yeah.
Now you're good to go. Perfect.
Perfect. Wonderful. Here we go. Take this out. Is everybody good now? Awesome. Thank you so much. So this is the CDC tracker that shows us the daily cases. And you have on the top as the number of cases in the US exceeding 26 million. This data is a few days old, but this is only, and it's showing the number of cases, the vaccines administered in the US, as well as the number of mortalities we have. So the, as you can notice, the vaccination has got on a good start. For some reason, America, some parts of South America, Europe were hit the most from this. And you can continue to track these on a global level as well as a US level. The next is the total number of cases. It's kind of strange that they talk of more than 100 million cases worldwide, but only 57 recovered. There are some long-term sequelae that have been described, and I wonder why that number, or what is the criteria for it to go up. But certainly, if you look at the number of deaths, it's 2%. So overall, the mortality from this is on an average about 2%. This is for the United States. We're almost looking at 450,000 here. Mortalities with more than 26 million cases. I kind of attribute this partly to the fact that we have a lot more testing. It's been more easily available lately. So it's a very different, the numbers tend to reflect a lot of that. There's also been reports where hospitals, nursing homes have reported even suspected cases of COVID as COVID cases, and that adds to the number. So I kind of feel that it is probably an accurate reflection of what's going on, while the others may not necessarily be a true reflection. I'm sure all of you wonder why China is not in this list, but that's a different topic. Now, this is the CDC tracker about the a very interesting trend, the daily cases reported. And you can see the green arrow points to the introduction of the first vaccine in the United States. And you can see that there has been a decline, as shown by the red arrow, a rapid decline in 2 months from this. We always worry about Christmas or holiday times and events like the Super Bowl, because if people do not comply, these events tend to be more super spreader events rather than just social events. So that has always been a concern. And I'll talk about what are the simple steps we can do, which probably all of you know, but I'll show you how the impact of these small steps is on the things going on. So what is the coronavirus? It's basically, we've known the virus all the time. This is just a new strain of a coronavirus that we've known for a long time. The name corona comes from a crown-like, and I've put some yellow arrows on the screen to show that the proteins on the virus envelope kind of stick out, and that's what's leading or giving it a name. But the most important part about that is also we do not have antibodies. So we have antibodies against the coronavirus, but we do not have antibodies against those big proteins. And that is the protein that attaches to the cell and gets inside. Apparently, this protein attaches to the ACE, or let's call it some name, something on the, it attaches to a protein on the cell, and all of our cells have that protein. So the virus has a very easy way of getting into the cell, and that's why it tends to infect human beings very rapidly, because this large protein on the virus can adapt and attach to the cells very quickly. Remember, we do not have antibodies against that protein, and that's the reason why we cannot fight it, and none of us have been able to fight it. Even though we have antibodies against different strains of the coronavirus, the COVID-19 is unique because we do not have antibodies against this specific protein. And I'm sure Rekhaji will talk about how we will be targeting treatments or vaccines against certain proteins of the virus. So that's the whole goal of the understanding the structure of this virus. So how does it spread? Well, it's been more than a year and a half, and we still have a lot of theories about how it spreads. I'm sorry, this seems to be acting up. It's not going up instead of going down. Okay, there we go. So how does it spread? Well, obviously, people who are infected tend to spread it the most. It spreads by respiratory droplets. So when we talk or we sneeze or we cough, these respiratory droplets which have the virus tend to go into the air. The heavier droplets tend to sink close to you, but the smaller droplets which are lighter tend to float further away. That's why they came up with the idea of that 6 feet, the zone of 6 feet, because the respiratory droplets are most concentrated within 6 feet. And that's what tends to cause it. But remember, you can get infection even if you're more than 6 feet away, or you may not get an infection if you're within 6 feet. There's many reasons for that. The respiratory transmission, the transmission from these droplets also will increase if you're in a poorly ventilated space, if you're in a very crowded space. And that's another concern that people have. And that's why we recommend avoiding big crowds or avoiding small spaces. Remember, people who are infected but they have no symptoms can also spread, although that's not the norm, but we keep that in the back of our mind. There have been a few cases of reinfection, but that's because of lack of immunity, but that's not very common. The other question is, can we get it from contaminated surfaces? Now, although we talk about your table or your computer or your handles, door handles causing it, that's really not the main modality of spread. We do emphasize on kind of wiping down surfaces and washing hands in healthcare, but I think in general, in your house, you don't have to go crazy over wearing gloves and wiping and sanitizing all surfaces. Just simple things like washing hands should be good enough. What about transmission to your pets or animals? I think, none of us, it's not very common for us to have pets, but that's really not something which is common. So you cannot get it from a pet or an animal. So how do you prevent the spread? And I think it seems like a lot of us, a lot of gens really know why or how to prevent the spread, and they've already talked about it and they've practiced it. And as you can see, I put a picture to make it a little lighter for us to say that there's a reason why why the sadhvis here are putting something on their face to protect not just their germs from spreading, but also from getting germs from others. So the oral mucosa is a source in which you can have transmission. Your nose and your mouth can lead to entry of the viruses. Now, there's some questions and some talk about Anthony Fauci talking about double masking, or what is the idea? What is the concept behind wearing two masks and not wearing one mask? Well, think of it like this. A N95 mask, which is the mask that kind of stops or prevents 95% of the small particles from getting into your airway, has typically 4 or 5, even 6 layers sometimes, but typically there are 4
ठीक है
different.
लखविंदर जी, मैं आपको है ना मैं आपको कॉल करती हूँ वापस. हेलो.
So what ends up happening is,
Hello?
Hello. Can I ask everyone to
Yes.
mute themselves, please? Thank you.
so what happens is, what we are wearing now is a simple mask that we are asking people to have when they're in the society, when they're in the community. So obviously the concept is, if it's a simple cloth mask, will it provide enough protection? So came up the idea of having 2 masks. But more important than that is, I feel, is the mask properly fitting? Does it cover your nose? Does it cover your mouth? And is it properly fit? You know, it shouldn't be very loose, should cover. That's, I think, a more important way of looking at it. It's funny, I have a lot of people come in my office and their mask is covering their mouth, or it's on their neck like a piece of jewelry. And I tell them that you have a beautiful mask with a wonderful print on it, but it's serving more like a scarf probably, rather than a mask. So wearing a mask in the right way is important. How much of an impact does the mask have? So if you look at this, this is a study published in an infectious disease journal in the United States that looked at the impact based on the data they had in the last 6 months to a year. What would be the impact if the arrow on the graph on the top is showing you on the infection. So if nobody wore a mask, that's the blue mark, you have, let's say, an incidence of 150 cases. Even if 50% of the people wore a mask, and you can see how much of a dip, there's a delay in the number of cases as well as a drop in the number of cases. And if 75% people wore a mask when they were interacting or in a common place, you would have a dip from 150 to 100. Now, this is only the chances of getting an infection. So clearly you can see that wearing a mask has a big impact. It doesn't matter how the mask is or what it is, but just simply wearing a mask. Not just that, the graph at the bottom even shows the impact on mortality or death rate and hospitalizations. The bottom line is, if 75% of the people were to wear a mask, there's a 47 to 50% reduction in number of deaths. That's only wearing a mask. However, if you combine this with sheltering in, that means if you combine it with staying at home, not going out in big groups, right? You wear a mask and you don't go into a big group. You don't go to a big Super Bowl party. The decrease in death is 84 to 85%. So without a vaccine, you're talking about an 85% reduction in getting sick just from wearing a mask, and avoid going to a good common group or staying at home. Okay, I hope that's a very powerful study showing you the impact of the mask. So I don't know how many of you plan to go to a Super Bowl party today, but the concern I always have is that in a party like today, when people are enjoying themselves, many of them don't wear a mask. They think they don't have symptoms, so they're not spreading an event, but they could have an infection and they could spread. Most of these places are crowded and small. The duration of this whole exposure is more than 2 to 3 hours. So that's why this concern of these events can lead to spread of infections. That's the biggest concern we have. Okay, so how to wear a mask? It seems like a very silly thing, you know, seems like a very simple thing, but touching base on the previous one, you know, that's probably one of the reasons why even in our temples, they've reduced the number of people, they have occupancy in temples. And that's the whole idea, that if you restrict the number of people, there will be social distancing. Requesting everybody to wear a mask will have a big impact on reducing the spread. So that is why Governor Cuomo has these executive orders restricting all community places, restaurants, movie theaters, on reducing the occupancy in all of these. So that's been one of the strategies always. How to wear a mask? I think something that is very simple and we take for granted, and probably I'm the one who probably needs this first because I have not followed this myself many a time. The best practices would be wash your hands with soap and water or with sanitizer. So remember, soap and water is as good as sanitizer. You know, we always, when I was in the store one day in BJ's, there was an announcement, oh, the sanitizer is available. So I said to myself, oh my God, I need the sanitizer for my office. I should rush. So I asked somebody, where is the sanitizer? Where is the sanitizer? By the time I reached the shelf, it was all gone. Because people have kind of felt that the sanitizer is like everything. But remember, if you just wash your hands with soap and water, that is as effective. So in my office, I constantly am washing my hands with soap and water all day, 20 times a day. And I also have a cream, a big bottle of cream there, where I kind of make my hands soothe so that I don't crack my hands. And I can continue all day without all these protective equipment. But the simple thing is washing your hands with soap and water many times a day is probably the best thing you can do. Okay, so the second picture is clearly showing, hold the mask with a loop and put it around your ears. Don't touch the mask when you're putting it on. When you take it out, it is the same thing. Put your fingers behind the loops and take it out. Avoid touching the front because that's where all the particles are. If you were breathing constantly and the air was constantly going through the mask, all the particles or the infectious particles are probably right in front of your nose. Take the mask off and simply wash it with soap and water, and that's all. You're good to go. So one thing I've seen a lot of creative masks and designer masks in the market. They look beautiful and women really love them. The key is, are you following the simple steps and are you wearing the mask? Is it a proper fitting mask? That's the most important thing, okay? So how to prevent spread? Simple things, stay 6 feet from each other. I remind my wife sometimes about that when she's very upset. I'm like, it's quarantine time, let's say stay more than 6 feet apart. Well, that applies more for people you don't know, because if you're in the house with someone, that really is not a big deal, but staying 6 feet apart in your office, in your workplace, in the grocery stores, in these places is very important. Obviously avoiding large crowds. And one of the concerns is that asymptomatic people don't know they're infected, or they got infected, but they don't have the symptoms. And they are going in a place assuming that they're not sick. That's one of the concerns we have. Avoid poorly ventilated spaces, washing hands with soap and water, and sanitizing. So if you don't have soap and water, hand sanitizers are simple. They should have about 70% alcohol in them. That should be good enough. Okay, so, you know, these, while my son was home, he kind of was coming up with the idea and said, I told my son, you know, he said, why can't you go to school? And I told him a simple thing, you know, when I look at people in my office, my staff, we don't comply with all these guidelines almost 15 to 20% of the time. I mean, there's practically, if you're working in a busy office with patients coming through the door, it's difficult to stay 6 feet away. I have to talk to them, examine them. I mean, most of my patients are even upset. I don't shake hands. I don't get close to them. I'm used to giving them a hug all the time. I'm not doing that anymore. So we sometimes get tired of wearing the mask. It's tough to breathe in the mask. We take the masks off now and then. So I told my son, well, you know, in my office, my staff cannot comply with this 100% of the time. how can you expect children to do it? It's so hard for children, and that's why schools should be shut down. So he said, no, I don't think schools should be shut down. I think kids are smarter. I'll give you an example. I know Zoom better than you do. And I was like, you're right. But you know, these things are not easy. So he said, let me come up with a guide. And he came up with this very simple, easy guide, which is now going to be spread through the New York City Department of Education on their website in all the schools in New York City. It's a guide that talks about what are the simple things you can do to stop the spread. Simple steps in. It's like a 20-page guide with a lot of pictures and makes it easy and friendly. If you're interested, please let us know. We can forward it to some of the schools or even to your children. Next is what are the symptoms? I think everybody knows this slide better than I do, because I have seen probably people with more of the GI symptoms, where they have diarrhea, nausea, vomiting, belly discomfort, but they also have fever. And that was the common thing. But remember, there's commoner things, and most people actually don't get sick. Most people have very mild symptoms. The range of symptoms can be mild to moderate to very few people getting very severe symptoms. Most people will have mild symptoms, body aches, fevers, like a flu, some trouble breathing or coughing, headaches. Few people will say that, oh, I've lost my smell and taste. And that is a common symptom, and that symptom can remain actually even for a few months. Even after you recover, it may still be there. A sore throat, runny nose, you know. So that's the one thing. The other thing is, remember, you can get symptoms in as less as 2 days after being exposed to up to 14 days. And that's why the idea of the quarantine and the time period of quarantine has come up from. And we'll talk about that a little more in detail. And finally, when should you, call your doctor, get or seek medical attention? Well, obviously, if your symptoms are very severe, but in the elderly, we talk of some other things, you know. If you're very weak or tired because your oxygen levels are low, you're a little confused, or you have some chest discomfort, or you're breathing very hard, or sometimes people notice that the lips are blue. These are all signs of the oxygen levels going down. But nowadays, there's many different options, and it's easier to kind of seek medical help with the testing that's widely available and more awareness about it. I think all of you are very aware of the symptoms, and testing is also easily available. So I'm going to stop here. I know you probably are all excited about knowing about the medications, treatment, and vaccine, but we'll continue with that. Thank you so much. I think we should probably just continue with Dr. Nanda Ramsarup now, or I can just have Ruchiji to probably introduce and take over. Ruchiji, how should I just say pause share?
Yes, you can actually unshare now. Thank you so much, Dr. Mehtaji. It was quite informative, and I'm sure we've all learned more about the COVID-19 pandemic.
Thank you.
Did you unshare your screen? There's an unshare button on top, right on top, and it's red. Perfect. If you don't mind, please mute yourself. Now I'm going to continue on to introduce our next esteemed panelist, Dr. Nandaji Ramsarup. Dr. Ramsarup's medical career started at Boston University, where she received a BA in biology, and 2 years later received an early acceptance to Boston University's medical school, where she graduated in 1995 with a doctorate of medicine. Then Dr. Ramsarup continued her internship and residency at NYU Medical Center with rotations in Bellevue Hospital, Tisch Hospital, New York Department of Veteran Affairs Medical Center, and Memorial Sloan Kettering Cancer Center. An expert in the field of internal medicine, Dr. Ramsarup has received many accolades, honors, and awards. She has also produced a pictorial handbook called Together Say No on substance abuse. Dr. Ramsarup has served as an internist at Queens Long Island Medical Group and Advantage Care Physicians, She is currently the treasurer and board member of Physician Proactive Protection Risk Retention Group and spends most of her time as a director of Northeast Primary Care Center. I'm excited to welcome Dr. Nandaji Ramsarup.
Good morning. Nice to meet you. Can I
morning.
have a share the slides? Because I can't seem to get the slides.
Would you like us to present your slides, or will you be able to do it?
I can't seem to get them up, the slides.
Okay, so what you do is, you have it in Google Slides, I believe. Am I correct?
Yeah, let's see. Oops, let me see.
Can you go to your Google account?
Do you want me to share it, Ruchiji?
Yeah, that would be great.
Let's see. Okay, can you see it?
Not yet.
Go back to the meeting.
Okay, no,
You have to go. Are you sharing your screen?
sure, no. I have it on my screen, but I don't know.
So what you need to do is you go, there's a panel in the bottom and it's a green button that says share screen. It's through Zoom. So you're gonna press that green button that says share screen. And what you need to do is, instead of showing us your email account, you're gonna move to the presentation, which is gonna be on the top of the bar.
Okay,
Now it's bring it to that. Click on it. No.
Perfect.
Can you-
So you're gonna download it as,
can you see the screen?
I do see the screen. Put your cursor higher, please. And I believe, are you signed in?
Yes.
Okay,
No.
so click the three dots
3 dots.
right next to sign in.
Here.
Do you see it?
Yes.
Click the three dots,
Yeah.
and it should say download.
No, there's no download. It just says pause.
Okay, so I think what you need to do is sign in. Right,
Okay.
the white button.
Which is the white button.
Right next to three dots, there's a sign in button.
I don't see a share.
Ruchi, do you have the document? You can share it,
Yeah.
please.
Let me see if I can share it.
Dr. Nandaji, can you stop sharing, please?
Okay, let me see.
Yeah, and Ruchi will bring it up. Thank you.
Just let me know when you want me to move to the next slide.
Okay.
Perfect.
Okay.
Does everyone see the presentation?
Yes.
Great.
Can you move forward? Okay, so I'm going to present who should get tested. So we think anyone with symptoms suggestive of COVID-19 should get tested. So any of the symptoms, it doesn't matter if you have one or two or all of them, but any suspicion should definitely get tested. Close contacts for anyone that's been exposed to someone with COVID-19. So close contacts is defined as less than 6 feet distance and for more than 15 minutes of contact. So that could be cumulative contact over 24 hours. So if you're caring for someone and you stop in their room for 1 minute, but you do it 15 times through the day, that's still considered close contact and should be tested. And anyone that participates in any large social gathering, mass gatherings, should also be tested. And anyone with recent travel outside of New York State should also be tested. Next screen. Okay, we're also recommending that anyone undergoing surgical procedures to be tested. Can you go back one slide? So the recommendation is to be tested 3 days before your procedure. Patients that are receiving any kind of immunosuppressive therapy, chemotherapy should get tested prior also. Obviously, anyone living in long-term care facilities should be tested periodically, and employees are required to be tested periodically as well. People that should not be tested are anyone that has been previously diagnosed within COVID-19 within the past 3 months should not be tested. There's no need to be tested. You're considered immune for that 3-month period, and it's very rare to have a new infection. If it would be a new infection, it tends to be with a new strain of the virus, and it would be after that 90-day period. Next screen. So when to get tested. So we're not sure when the optimum time should be. It's unknown how soon after exposure we can detect COVID virus in your system. Studies from China in the very beginning stages suggested that it takes about 5.8 days from the time of exposure in order for them to be able to pick up COVID virus through the tests. A person is most infectious the 1 to 3 days right before they develop symptoms. Okay, so the CDC recommendation is to get tested 3 to 7 days after exposure. Next slide. So New York State has very severe travel restrictions for those traveling outside of New York. All right, so travelers that live or travel within the contiguous states, so New Jersey, Connecticut, those are exempt from restrictions. If you travel outside of New York for more than 24 hours, you must obtain a COVID-19 test 3 days before your re-entry back into New York. Okay, once you arrive in New York, you need to quarantine for 3 days, and on the 4th day, obtain a COVID test. If both tests are negative, then travelers may come out of quarantine. Next slide. Okay, so travelers who are out of quarantine for less than 24 hours, they do not need to have a COVID test before arriving back in New York. But once you arrive back in New York, you need to isolate or quarantine for 3 days and then take a COVID test on the 4th day. Okay, so travelers, they also require that you fill out a travel form once you arrive back in New York. And those that do not fill out the form are subject to a $10,000 fine and may be brought to a hearing in order to complete a mandatory quarantine. So they're taking it very seriously. They want to prevent the spread through travel from outside of New York. Okay, next slide. Okay, so what's the best test to get? There's 3 different types of tests. The first type is the type that is looking directly for nucleic acid associated with coronavirus. So the most common is what's called an NAT. So they take the nucleic acid through a process and amplify it. So they can require very small quantities of the virus in order to detect COVID-19. The most common type is called a reverse transcriptase polymerase chain reaction. So it's called an RT-PCR. That's the one you hear most about. It is actually very accurate. False positives are very rare, and it needs only a very small amount of the COVID vaccine in order to develop a positive response. The type 2 is an antigen test, which is looking for those proteins on the coating, the capsid of the coronavirus. The sensitivity is lower, and it does need to be confirmed by a nucleic acid test. It needs symptoms for at least 5 to 7 days to be the most accurate. Next slide. The other type of test is called an antibody test. This is more to identify patients that have already had the vaccine. In order to develop antibodies, it takes anywhere from several days up to 2 weeks for antibodies to develop. So to use an antibody to look for acute disease, you wouldn't necessarily be very accurate. The only thing also with the antibody test, it can potentially cross-react with coronavirus. So when someone that's never had disease, has no contacts, we always have to suspect that it may possibly be a false positive, especially if it's a very low titer. Okay, and testing also depends on the type of specimen, where we're getting the specimen from. Studies have shown that those specimens that come directly from the lung are the most accurate. The next would be anything from sputum coming from the lung, the nasopharyngeal, which is the turbinates, so high up into the nose, our next accurate, saliva, and then the least accurate is the oral swab. And the studies have shown that someone that collects the sample themselves is just as good as a physician or a nurse or a health practitioner that obtains the sample. So those home tests are good as long as it's looking for, it's a PCR test. They're just as accurate as those that are done in a doctor's office. Next slide. Okay, so New York State also has specific quarantine recommendations. So anyone exposed to COVID-19, they have decreased the mandatory quarantine down from 10 to 14 days. And quarantine can end as long as there's no symptoms that develop and you do not require repeat testing in order to end the quarantine. Positive tests with patients that are symptomatic, they do need to isolate. There is a difference between isolate and quarantine. When we say someone is positive, they must isolate. So they also need to stay away from people that are in their own household, wearing masks. They need to isolate from sharing the same cups and spoons and things like that as well. All right, so they need to also isolate for 10 days since the onset of symptoms. Right? Isolation can end if there's no fever for 3 days in a row without taking any fever reducing medications and that there's been an improvement in symptoms. Next slide. Next slide. Okay, so positive tests that are asymptomatic, they do quarantine for 10 days. Quarantine starts at the time of the positive test. Okay, you do not need a negative test in order to return to work. CDC is recommending 7 days of quarantine as long as the second test you have a negative test. Long-term care residents, so it's 10 days of isolation from the onset of symptoms and a negative test in order to come out of quarantine. Long-term care employees also require a negative test before they can return to work, and they are mandated to finish the full 10 days of quarantine. I think that's it for me. Okay.
Thank you so much, Dr. Ramsaroop, on discussing the COVID-19 symptoms. This presentation was quite informative. I'm just going to share my screen to discuss the next panelist. I can't wait to introduce our next distinguished guest, Dr. Rekha Bhandari. Dr. Bhandari received her MBBS from Adi Chandragiri Institute of Medical Sciences in Mysore, India. Dr. Bhandari completed her postgraduate training in internal medicine at Wyckoff Heights Medical Center, Brooklyn, an affiliate of Cornell University. Her training culminated in her becoming chief medical resident. She then attained her fellowship training in geriatrics at North Shore University Hospital in Manhasset, New York, ultimately becoming board certified in internal medicine, geriatrics, hospice, and palliative medicine. Throughout her medical career, Dr. Bhandari has contributed in various publications, and received numerous awards and honors. Most notably, she is a recipient of the prestigious Ellis Island Medal of Honor. Dr. Rekha Bhandari has dedicated her life to practicing medicine. Since 2001, Dr. Bhandari has served as the Vice President at Glen Ridge Medical Associates. Can I ask everyone to mute themselves, please? And as a director of the Division of Geriatrics and Palliative Medicine at Wyckoff Heights Medical Center. Additionally, she serves as a director for HOPE program for the elderly. Currently, Dr. Bhandari serves as the Chief of Geriatrics at Kingsbrook Jewish Medical Center and the Director of Palliative Medicine at the Brooklyn Hospital Center. She is also the founder and CEO of a healthcare technology startup called Deja Vu Health. Let's welcome Dr. Rekha Ji Bhandari.
Can everyone hear me now? I just unmuted. Okay. Thank you, everyone. And it was great hearing both the physicians ahead of me. I'm going to share my screen right now. Is everyone able to look at my slides? Yes, good. Okay. So, I mean, we heard Nileshji, we heard Dr. Ramsarup talk about the COVID, the burden, the testing, etc. And also, I'm very impressed with Dr. Ramsarup, where you caught up with the DOH guidelines on COVID testing recommendations, specifically for long-term care residents, which constantly has changed. Obviously, as a person who enters a nursing home, I've been asked to check tested twice a week. When we started off during late last year, it came down to once a week. Now we are back to twice a week testing for the employees who's entering long-term care, and as well as the residents who are residing in there once a week. And obviously, we all heard, we saw such devastation in elderly. And the mortality of COVID-19 related deaths still happens to be a predominant senior population. Around 69% of population who lost their lives happens to be of seniors in age group. So I know Nileshji talked about it, but I just want to start off my case to make for the public why vaccine is so important, right? Just to elaborate on the acronym of what is SARS, we know it's called severe acute respiratory syndrome of coronavirus 2. It's extremely contagious, like Nileshji said. And as we speak today, you see the amount of the deaths and the devastations that we saw globally, and more so home here in the United States. So if someone asks me, why should I take vaccine? And this is what I would say. I'm like, being sick or, versus seeing a whole spectrum of mortality, or taking the vaccine, and any concerns. And I hear someone like me who are, out there who have been an example, who's taken the vaccine myself. And I'm here to burst all the myths and the beliefs out there, because there's media. Unfortunately, there's media and there's anecdotal cases which is being reported in the media day in and day out, and hence the public is real skeptical about the vaccine. Now, how does the vaccine work, right? Let me, even before we go that, for most vaccine against any emerging diseases, the challenge is about the speed. The skepticism and the distrust which I see from the population is, how come the current healthcare scenario developed this vaccine so fast? Is it truly safe? So, these vaccines, specifically, let's say the current season flu vaccine, it does take around 6 months to develop, and it does take years to develop most of these traditional vaccines. However, the revolutionary aspect of mRNA vaccine is the speed at which they can be designed and produced. This is why they're leading the pack the mRNA vaccines that we see in the market today, both from Pfizer as well as Moderna, is leading the pack as vaccine for the candidates who deserve it. Hence, the National Institute of Allergy and Infectious Disease provided financial, technical, as well as clinical support. I just want to say this. I mean, truly, it is reported out there. It is reported that Moderna, it took 2 days for them to really come up with the mRNA code. And it took 2 months for them to go into production and development. So this is a pretty fancy, relatively and extremely high technology. But I also want to tell people who are listening today, the mRNA, injecting mRNA and to see whether an antibody is developed is not as new as it sounds. The scientists and researchers have been using this technology since 1990, and also, they're looking at the antibody response. So when the pandemic hit, the technology was adapted to develop a vaccine, and hence we came up with such a fast, fine product, right? So how does this vaccine work? Like I said, first of all, the way it works is this, right? I mean, we have typically a regular vaccine, the childhood vaccine that we have all heard. We have all heard about influenza vaccine. When we inject the vaccine in the body, usually it could be an antigen, which is live, or an attenuated virus, which is injected into the body, which can be a purified protein or a polysaccharide. And once the antigen is injected into the body develops a cells that we call it as antibody. These are the fighter cells. For someone who does not understand these technical words, I call them as, these are the fighter cells. And body prepares these fighter cells it's almost, they're like soldiers in your body. They're now, hey, they identified the enemy. Once that in the body exposed to this enemy, the fighter cells are ready to fight. They go in, they kill the enemy, meaning, your infection is fought even without probably most of the time you being aware of it, or with minimal symptoms like what we might see in influenza vaccine. So that is the base of a vaccine work. Now, the concern of, hey, you're injecting the COVID vaccine inside my body, I might get COVID infection. This is not true. I mean, I'm not sure whether in audience we have younger crowd. I call it as a Snapchat kind of technology. The mRNA is a blueprint, right? It is not a true vaccine. It's a blueprint of the spike protein, which we see on the coronavirus. It's injected into the body. It sends the messages to the cells within the body saying, hey, this is how a spike protein should be appearing on a cells, and that spike protein appears. And within the body, now we see the fighter cells being active and fighting it, and now we develop the antibody. So the concept of our DNA getting changed, the concept of injecting the virus inside the body should be bursted right there. So I'm going to skip this, but obviously, I just explained exactly, and I know on the right side, it seems more like a medical student kind of an education, but anyone can see that, if you look at the whole, the picture there, within last 1 year, the scientists have gone so quickly on identifying the life cycle of this virus. We have tried every aspect of how to deal with this virus. Right? I mean, we were starting from your hydroxychloroquine to the steroids, as well as the monoclonal antibody, the current pretty fancy treatments for, the COVID-19 virus. So now let's come back to, before I go to the vaccination, I was hoping Dr. Mehta, Dr. Ramsarup will touch it, since it was probably not within there. I want to touch on the monoclonal antibody, but I get questioned on that constantly. Now, 2 companies who have been approved, remember, all the treatment and the vaccine we are talking about right now is under EUA, that is Emergency Use Authorization by FDA. So the monoclonal antibody, which became so popular with our previous president talking about it, Regeneron is a company. And the medication cocktail which they used is 2 different kinds of monoclonal antibody. which is tongue twister, guys. Even I have to look at it before I mention that name. Is called Cabirivimab and Imdevimab. And there's a second company called Eli Lilly, which has come up with something called Bamlanivimab. Now, for non-medical people, why is it so important? Let's say someone within your family or friends, someone develops COVID-19, they have mild symptoms. When I say mild symptoms, they have body aches, fever, headaches. They can call the private physician who can coordinate this treatment. This is one dose. Most emergency room throughout the country is administering it, provided it's coordinated by the physician, your physician. You call the emergency room, you can get your patients or get your family in, get the treatment and bring them back and follow the quarantine requirement that Dr. Ramswarup talked about it. This is also a great game changer. Remember, vaccine is very important. At the same time, the treatment is also something that we all look for, correct? So this is something which is truly a game changer. Technically, we are giving the antibodies externally, one dose, it's an infusion, 1 hour infusion, you come home and continue to take care of yourselves, okay? So now who should get vaccinated and what's being done right now? We are in phase 1A, 1B. Hopefully, we will go into phase 1C and general population should be receiving this vaccine. Before I go on to it, let me go into these individual vaccine. I'm sorry about it. So we do have Pfizer, we do have Moderna. Both of them have been approved by FDA as EUA. If you see the effectiveness on the screen, Pfizer has 95%, Moderna is 94%. Others are pretty close. Even though Johnson & Johnson had 60 change, you also heard Dr. Anthony Fauci recently saying the mortality benefits is uniform of all the vaccine, meaning someone who decides to take Johnson & Johnson might have a little more chances of getting the infection, but people might not have the morbidity and mortality that we saw without vaccination. Both the vaccination currently, vaccines which are available in the market are mRNA vaccine. Pfizer is given, both of them are given in 2 doses. Pfizer is given 21 days apart, and Moderna is given 28 days apart. Novavax, they've announced 2 doses. They've not given us how many days apart that it's given. And AstraZeneca, as you see on the screen, it's 28 days apart. And Johnson & Johnson has come up with 1 dose. I mean, they've not been approved yet. We're waiting on the EUA approval for the last 3 of those vaccines. The challenge of Pfizer, as most of you might know, is the storage. It does require a heavy restricted temperature versus Moderna is more liberal. So when you go, when this becomes public, I suspect Moderna might be a little more easily available to general public because the requirement of storing of this vaccine is a little more easier for a community-based practice like me or others. While Pfizer is someone which the health systems are using it, and both are equally good. I get asked this question, which one is better for me? I would say both of them are equally good, as you see on the slide there. So now coming back to phase 1A, the question is, there are some people who are extremely anxious in receiving it. The first priority was healthcare personnel, all the spectrum from physicians to the nurses to the CNAs to anyone who was coming into the healthcare system as a worker. They were considered as healthcare personnel, and obviously my patient population who are residing in the nursing homes. And like I said, we saw devastation, and obviously they were the first priority to receive the vaccine. So phase 1B or the frontline essential workers. And also there's a lot of question on who's considered as frontline essential workers. I've listed here, these are the police officers, the cops, firefighters, correctional officers, people who are working in food and agricultural workers, postal service, manufacturing workers, grocery store workers, public transport workers, etc., as well as the teachers, teachers, support staff, daycare workers, etc. Phase 1B also includes people who are 75 and above, people or seniors who are residing in the community, but they have high risk of hospitalization, who have chronic illnesses. And also, if they are residing in long-term care, they obviously get bumped up to phase 1A. 1C is people beyond the age of 65. Again, any of these category, if they're residing in an institution, they get bumped up to 1A. But phase 1C or for WHO guidelines of seniors, which is above the age of 65, and also includes people between 16 and 64. But remember, Pfizer is approved for the age group of more than 16, and Moderna is approved for the age group of more than 18. The research studies are happening to research on younger population. It's still not out there. We don't have a consensus. But however, Moderna is approved for 18 and above, Pfizer for 16 and above. And as vaccine availability increases, obviously the recommendations also will expand. And this includes the pregnant women as well as women who are breastfeeding. That was one of the earlier limited guidance which came up when the vaccine was rolled out in December. Now we know better, 2 months, and it's so intriguing to see the information that we are collecting and we are improving is so quick. It's not months and years anymore, it's weeks and days. So now it is deemed to be safe for pregnant women to take it, as well as women who are breastfeeding. So side effects, this is something which I feel where public is extremely concerned about, because the media is showing so many anecdotal cases. But in my own experience in a health system where I lead one of the largest nursing home industry in Brooklyn, and we have rolled out more than 3,000 plus first dose and equal number of second doses by now. And the most common side effects, it's not just me saying, this is collected by the CDC, happens to be pain at the injection site, people reporting fatigue, headache, muscle pain, and joint pain. I also want to make sure that I want to convey this, that these are extremely time-limited common side effects. We are looking at somewhere between 24 to 72 hours. And the common side effects, which I'm talking about, were a little more, slightly more after the second dose, and extremely rare occasions of anaphylaxis. And since it's such a novel vaccine we are talking about, the anaphylaxis reaction can happen even with regular medications, regular vaccines. So, however, the FDA and CDC guidelines is pretty strict, and people who have received the vaccine can tell about it. People have no serious allergic and urticaria or anaphylactic reactions in the past. After you receive your vaccine, you get monitored for 15 minutes. Your vitals are monitored, et cetera, et cetera. But people who have history of allergies, seasonal allergies, they're taking some kind of medications, et cetera, et cetera. Of course, discuss with your primary care physicians before you accept it. But if you're approved, then you're monitored at least for 30 minutes before you're allowed to go home. And also remember, it's not that when there's an anaphylactic reaction that you're not on their own. These the systems who are injecting the vaccines are required to be prepared with providing you the medical care immediately. For example, in our system, we had everything, including the crash cart, the EpiPen, everything ready before we started rolling out the injections, vaccines in our patient population. I mean, I'm going to touch the most common questions. I'm sure the questions will come up with people who are listening today. So first thing is, if someone has received that monoclonal antibody, the treatment which I was talking about, when can they receive the vaccine? Both CDC and FDA said, if you receive the monoclonal antibody, you should wait at least for 90 days before you think of receiving the vaccine. Now, if someone has not received the antibody, but they had COVID-19 infection, are they eligible? The answer is yes. The answer is yes. If they don't have symptoms, they've come out of the quarantine, they don't have an active symptoms anymore, the vaccine is eligible. They're eligible for the vaccine. But most think tank says, you probably have developed natural immunity because of recent infection. So can you wait out for a month or two for let the others receive? The answer is yes, but again, it's individual choice because we don't know how long that natural immunity lasts. So we will say you are eligible, but if you want to wait for next month or two, that's also a good choice. Now, after getting COVID vaccine, will I test positive? between 1 and 2. And I've seen this happen in my own private practice. People became positive, but I want to again bust the myth. This is the same discussion I would have for my seniors when I'm giving my flu vaccine every year. Doc, I got my flu vaccine, I felt sick. So my duty to explain that, like Dr. Ramsarup said, the incubation period is there. I mean, unfortunately, probably there was an exposure to that virus. We got the vaccine and it became positive because now, you were out, during that incubation period, but vaccine itself should not cause a positive test. I want to burst that myth out there. And also the second thing is, which people are very complacent, saying, I took my first dose and I'm immune. And you saw that in my previous slide. If you want, I can go back if it is showing here. No, it's not. Never mind. So it does take, Pfizer takes around 50 to 60% antibody between the first and second dose, and obviously it goes up to the 95% what we saw. Similarly, Moderna has a little more antibody response after the first dose, and second dose we saw almost close to 94%. And the third most commonly asked question I hear, because public is hearing there's shortage of vaccine, that someone has Pfizer, now they might be offered Moderna as number 2 or the other way around. The guideline says the vaccines are not interchangeable. It is the responsibility of the governance to provide the same vaccine at the second dose. And that's the debate you're hearing at the state level as well as the feds level, how to roll out, because there are some think tank who's saying, if you're given the first, make sure you have the second dose inventory. But there's a second school of think tank who's saying, hey, listen, roll it out, give the first dose, whatever the inventory you have, we'll make sure that we'll have a second dose inventory available. That's the debate you're hearing between the mayor and the governor as well as at the feds level. But you cannot interchange. The answer is that. However, there are small trials being done in UK to see the efficacy of this combination vaccines. But again, that's more of a research issue, but there's no initial data as we speak as of now. Now, also everyone calls, how do I check my eligibility? Okay, so please note down this website. The eligibility and the availability in your neighborhood, in the communities, in this website, especially in New York. And also if you go to CDC, it's available for each regional area. The information is available up there. You can put in your information, you can put yourself on the waiting list, and whenever your cohort is ready for immunization rollout, you will be notified. More information at the CDC website. Please make a note of this as well. It's available on the up-to-date information on the COVID-19 vaccine, etc. And I would say trust this website to be the most scientific and authentic, rather than what we hear, the anecdotal cases in the media as well as TV. So I'm going to stop. I believe I took some time extra. I'm sorry about this. I'm going to stop at this and we'll open for question and answer. Thank you very much.
Thank you, Dr. Bandari, on providing us the ABCs of COVID-19 vaccination. We've had so many questions about the various vaccines, their efficacy rates, and short-term and long-term effects. For the next 30 minutes, we will open the forum to questions and answers. To keep the discussion smooth, you can either post your questions in the chat and I will read it to the panelists, or you can raise your hand and I will call on your name and you can unmute and then ask your question. We will try our very best to answer all questions. Let's get started.
Ruchi, you want to answer the questions that were on the chat channel, and then we can go live to the people?
Sure, I'm just going to open up the chat.
Ruchi, I think the first question was directed to can coronavirus spread through eyes or eye contact? I'd like to answer that question first. So there is no data that shows that coronavirus actually spread through the eyes. However, there were some studies that showed that the same virus that enters through the protein receptor, that receptor is in the eye, and the eye can actually be a mode in which it can spread. So the Department of Health actually issued a notice stating that everybody who's in healthcare should use universal eye protection, not just a mask. They have to use eye shields, face shields, or goggles when they're actually performing standard procedures. So that is now part of the standard universal precautions that we use in the hospital setting, especially when you're doing high-risk procedures. But we don't know if that is the main way in which it spreads, but certainly in healthcare, it is strongly recommended that you use eye protection.
Okay, so the next question is by Rajesh Ji and Sunita Ji Shah. This is directed to Dr. Bhandari. They said that Dr. Bhandari explained that, you know, these vaccines are soldiers. Are these live cultures?
Sorry, this is not live at all. The concern is, are we injecting the live viruses inside our body? If that's the question, the answer is no. It is an blueprint of an mRNA. It's not even, there are some viruses which we have used in the past, which we currently, vaccines which we use, for example, yellow virus vaccine. These are live vaccine, live attenuated vaccines. But COVID-19 is, like I said, it's a novel technology where we are sending in a blueprint of mRNA, which allows the spike protein to be developed inside the body, which is similar to COVID-19, and the phytocells develop against it. So we are not injecting the virus inside the body, if that's the question. And please be reassured that we are not going to cause the infection. It's just an mRNA. It does not enter your nucleus of your cell, does not enter your DNA setup, does not alter your DNA. So it stays outside the nucleus and starts this whole algorithm and how you develop the antibody.
Thank you so much, Dr. Bhandari. The next question is from Gunjanji. She asks, if someone is infected with COVID-19, but now the DOH has told them that they don't need to isolate, does that mean they can mingle with others with all the precautions? Or do they need to be tested, which would not happen for another 3 months? What's the correct protocol?
If Dr. Ramsarup is not there, I can answer that. I don't think there is any DOH guidelines there. Dr. Ramsarup.
Yes, can I just say, there's no recommendations to be retested after you've had COVID-19. People can shed virus for several months. The only ones that are required to be retested are those that are in long-term care facilities. They need to be tested negative before they can come out of isolation. That goes for the residents as well as employees. So someone in the community that's had COVID, once they've completed their 10 days of isolation, and as long as their symptoms are better and that they've had no fever for 3 days in a row, they're able to come out of isolation. They can get back to their regular life, but they still need to wear masks. They still need to follow just the general public guidelines for preventing the spread of COVID-19. You can test positive for up to 3-4 months with virus. We don't think they're active virus, they're particles of the virus that we're shedding, but it can make the test come back positive. There's no need to retest once you've been told you can come out of isolation or quarantine.
Thank you so much, Dr. Ramsarup.
Ruchi ji, this is Gunjan. Can I just ask another question? The reason
Sure.
I'm asking,
Yes, go ahead.
just follow up on this answer. Thank you very much. What I wanted to ask was, so this is because we are in healthcare, we provide home care to the seniors. So does it mean I can send my healthcare to take care of them?
So I think that you can still, because they're considered like hospital workers. They're essential workers. They try to get them back to work. But as long as they've been told they can come out of isolation, they are able to go back to work, but they do need to follow the necessary precautions, wear a mask, wear gloves, making sure they're trying to keep that 6 feet of distance from the client. Right?
No, they are the client, and we are thinking, can we send workers to their home? So you're saying yes.
Let me answer that, because the home care agency Ixus, SARS, ALPS, ATCs, SNFs, they're all regulated in a similar way. So if all the employee of the home health care is going home, they need to have a negative test like Dr. Salram said.
That happened until 3 months. Okay, that's what my understanding was. So, okay, we can put other people in harm's way. Okay, thank you so much. Thank you, Ruchi.
Thank you. Let's move on to the next question. Dr. Manojji Daga, he states that it looks like the vaccine should be given to ages greater than 16 years old. What can be done for children below 16 years? And is there going to be a vaccine that comes out for children?
Pfizer is currently authorized for ages 16 and up. Like I said, Moderna is 18 and up. Both the companies have started clinical trials for younger kids. However, we don't have a consensus yet, but remember, younger adults and kids are typically not at high risk for severe illness, but we don't have any answer yet from that research. We are awaiting that.
Okay, so the next question is, please explain the contents of the vaccine by Saruj G. Jain.
It's definitely not developed on unlike influenza, it's not developed on egg. It is an mRNA that is the content. When there's other AstraZeneca, as well as the India has Covishield, and I think the other one, they do have virus vector that is attenuated virus particles, but the ones which is allowed right now is an mRNA. It is, I'm struggling to explain it to in the layman. Maybe Dr. Ramsarup and Dr. Mehta can help me a little bit on that. It's a genetic material. It's a genetic material.
In simpler terms, it's just a protein. It's like a protein that we eat. It's a protein made of these small particles called amino acids, arranged in a certain sequence that looks like the actual coronavirus. So call it like our dummy that looks like the real coronavirus, but our dummy really cannot infect you, cannot do anything to you. So that's how I would kind of explain in simple words.
Thank you.
Thank you so much. I have a question actually in the similar lines. I spoke to my doctor friend yesterday, and she mentioned that she's going to wait for Johnson & Johnson's vaccine because Pfizer and Moderna, as you know, is mRNA based. And according to her, this is on mRNA-based vaccines are more on a molecular level, so which might lead to some long-term side effects like autoimmune diseases. So she is actually saying that she's going to wait for more of the DNA-based vaccines. Can somebody share some? Can one of the doctors please share some light on this?
Honestly, we don't know a long-term effects yet. If at all, I would be more comfortable with an RNA vaccine rather than a DNA vaccine. We don't know, like I said, whenever we have an EUA authorization, emergency use authorization, we have no long-term data yet. While we speak, while the vaccine rollout is happening, CDC is actively collecting the information. So I truly cannot, or none of us, physician fraternity cannot say at this point of time, one is better than another unless my co-speakers have a different opinion on that.
So a question to all three of the doctors. Have you been vaccinated?
Yes, my first dose was end of because that was available in my hospital. I took my first dose for December. My second dose was of January, and I'm fine. One of my most common side effects happens.
It got muted.
Oh, I'm so sorry. I took both the doses, Pfizer, because it was
Dr. Rekhaji, can you repeat what you said? And would it be possible if everybody else can unmute or actually mute, I'm sorry, so we can hear her response better?
Okay. So yes, I have been vaccinated. I took Pfizer vaccine because that was the first which was rolled out. I've been a healthcare worker both at the nursing homes as well as the hospital. I took both the doses. First dose was end of December and the second dose was in January. Minimal discomfort, very similar to any flu vaccine. It resolved with Tylenol or acetaminophen over the counter. I'm fine. Thank you.
Thank you. And what about Dr. Mehta as well as Dr. Ramsaroop? Have you been vaccinated?
So I've been vaccinated. I received my second vaccine this past Thursday. I did receive the Moderna vaccine. I did have some symptoms with it. I developed a fever after the second dose, but after 24 hours it resolved. And now I'm feeling fine except for a sore arm. So it went well. I had very few side effects other than the fever after the second dose.
Dr. Mehta?
Myself and Preeti both got the vaccines. We've been fine. We had the Pfizer vaccine. I was recommended by some of my friends who are in the clinical trials that you should take Tylenol 1 or 2 hours before, and I think Preeti kind of made a joke of this, saying that I think I didn't get the vaccine. They stole my dose because I didn't even feel it go in my hand and I had nothing the next day. So I said, don't worry, there's 40 million doses around. Nobody will steal your dose. But the point is, I don't think we felt anything. We were back at work and Preeti was doing her usual 20 endoscopies the next day. And I wanted her to close her schedule down, but she was like, no, I'm fine. And I called her the next day morning. I said, is everything okay? Do you need some help? Because everybody in my practice who took it, the senior managers, they complained of a lot of symptoms. And so I told Preeti, maybe you should not. And she was completely fine. I got my Pfizer dose also, and I was completely fine. I laugh about it. My son asked me, Dad, how come it took you so long to get the vaccine? You're a doctor, you're a frontline. So I said, no, I'm not a frontline. I do colonoscopies, I'm backline. I don't know if you got that, but.
Thank you so much.
Ruchi, I'll just give you my dad's case. He took the vaccine. He's 85 and he goes dialysis 3 times a week. So quite aged. He took the Pfizer vaccine Saturday, no symptoms, nothing. So I think it varies, but here's an 85-year-old gentleman that is, has all the underlying cases in terms of blood pressure and diabetes, dialysis, etc. So he had no issues. He was fine.
Thank you so much for sharing your experiences. Thank you. I think by sharing your experiences, it's actually helped us out because now, we see that, our doctors are taking the vaccine and they have confidence in these companies who are producing the vaccines. I'm going to move on to the next question. Dr. Binaji asked this question. It's directed to Dr. Bhandari. She says, I'm very allergic to many medicines. Do you think it is safe for me to take this COVID vaccine?
So there has been concerns on people with severe allergies and anaphylaxis. I would encourage to speak with your physicians because there has been a step back approach for patients underlying severe allergies and anaphylaxis, and because the environment has to be safe when you receive it. So yeah, there has been some concerns, but please, I would encourage you to speak with your physician and see if it's you're the right candidate.
Thank you so much, Dr. Bhandari. The next question is, how many death cases have happened so far for the age group of 2-year-old to 18-year-old kids?
I'm not really very specific with the number unless others have that breakdown of the data. We don't know, but I'm also positive that every global regional areas might be different unless someone else has that information.
There was some information published on that, but the numbers are really very low comparable to everybody else. I can provide that information. It has been published in some pediatric journals. Unfortunately, I do more of adult medicine. I can have that information available to Rajesh if you want, but the numbers are really small compared to adults. And as you know, it's the media that puts up these individual cases that come on the front page. I mean, if you look at the cover page of New York Times today, it clearly shows the decline in number of cases of the coronavirus over the entire country in the last few months since the introduction of the vaccine. So there is hope. I can definitely answer that specific question to Rajesh if they have some information. I'll get back to them on that.
Thank you. The next question is by Urmil G. Marshall. What was the primary reason Pfizer collaborated with BioNTech? Do you have any biometric data?
No. I don't know. I mean, we do not know whether it was clinical partnership, whether it was a much larger partnership, we do not know. But obviously that probably will never be on the public domain, not at this point of time, but we do not know why they had a collaboration.
You know, like everything, there's a lot of conspiracy theories. And if you listen to WhatsApp, and you'll hear a lot of different things about the virus strain being shared with certain companies, and there's a component of profiteering from this. I don't think this is the right forum to discuss it. I don't know how much information is known. There's a lot of conspiracy theories about it. So I'll just leave it there.
Ruchiji, I want to respond to those two questions, which I think is relevant. Someone who's obese or overweight, does the dose of the vaccine change? The answer is no. It is a universal dose for adults, so it's not weight-based dosing. And also the second question is why do we need 2 doses of vaccine? So I would say the reason, because Pfizer, after the first dose, saw around 52.4% efficacy. And after the second dose went up to 95% antibody production, versus Moderna, after the first dose, had 80.2% efficacy and then went up to 94.4%. Hence, 2 doses were recommended for both the companies.
I have Rajesh G. Patel raising his hand. I'm gonna ask him to unmute and ask his question. Rajesh G. Patel.
Yeah, hello, how are you? I wanted to ask you if somebody got exposed to somebody with COVID and that person told you that I had COVID recently. After how many days should I get tested for COVID? And how many times should I do it? And the second question is, if you have a positive rapid test, what is the incidence of false positive? And should rapid test be confirmed with the PCR test or not? So thank you, all these 2 questions.
I'll answer that. So for the testing for exposure, it's recommended you get tested within 3 to 7 days. That's the most likelihood for the incubation period and for you to start developing antibodies. So if you had a close contact, less than 6 feet, for more than 15 minutes, the recommendation is 3 to 7 days after exposure. The rapid test has a very high rate of false negatives, so it should always be confirmed with a PCR.
But what is the incidence of false positive?
I don't actually have the numbers of the false positives. The false positive rate is low, right? But the false negative rate for the antigen tests are high, right? The one that has the least amount of false positives is the PCR. Okay. It's actually rare to have a false positive PCR, right? And rare to actually have a false positive rapid antigen. They can have a very high false negative rate, meaning that you have the virus but test negative. So it must be confirmed with the PCR.
Okay, thank you.
If a rapid test is positive, most cases, in about 95% of cases, it's positive, right? It's only when it tests negative and there's a high suspicion that you've been exposed or may have the virus, and it's negative, that you need to get retested.
Thank you.
Even with the PCR, if you suspect you have it, you test negative initially, and then a couple days you have all the symptoms suggested of COVID, you should be retested.
Thank you so much. Let's move on to the next question. This is from, I believe, Lataji. She asks that she first got her vaccine, the first dosage, on January 16th, and her second one is scheduled around February 13th. Is it okay to delay this and take it at a later date? And she basically wants to know, how long can you wait in between the first and second dosages?
So the recommendation, Lethargy, is to stick to the schedule, because that's the efficacy that we have seen. Not a good idea to delay it unless and until there is some kind of unforeseen circumstances. So there is no guidelines on how long can you delay it, but they'll say, let's say if you missed for whatever unforeseen circumstances, take it as soon as possible. But we strongly recommend to stick to schedule, because that's what we see the efficacy and the antibody production.
I think there are some clinical trials, if I may, in England that are going on right now because of the shortage and the speed at which they're trying to vaccinate everybody. They're trying all these alternative things. They're trying to delay the second dose. They're trying to mix both doses because they want to give a large number of people the vaccine. So they want to give more coverage rather than vaccinate a few people. So they're doing actually some of those clinical trials with a large number of people right now in them with some preliminary data, but they haven't really published it. But Rekhaji, I'm not sure if you're aware, they initially talked about on BBC where delaying the second dose actually did not have an impact. I would not recommend that right now though. So till we have this research proven and published and reviewed by people, I would not recommend. So sticking to the guidelines is important because remember one thing, this is an emergency use authorization. So the vaccine has not been tested as rigorously as it should have been tested. So I think deviating from the guidelines right now is not a good idea.
Thank you. The next question is by iPhone. I don't know the name of this person. He or she asks, why two vaccines? I think it's directed.
I think I answered that, Ruchiji, because I think that was relevant when I gave the percentage of why two vaccines are important right now.
Okay, sure. Let's move on. This is by Dr. Sarojji Jain. What kind of allergies is being referred here for vaccination?
I'm assuming what kind of allergies that we are seeing after the vaccine?
I believe so.
So there is two different things which I think patients do get confused, the side effects versus allergies. What I experienced or what Dr. Ramsarup experienced are probably an adverse event or a side event, that local pain, the myalgia, the body ache, the fever. The allergic reaction is usually the rash, the swelling of the mouth, the shortness of breath. Those are the allergic reactions that we are looking at. Severe anaphylaxis could be when they have, sudden, they can stop breathing because it's a severe reaction, or severe bronchospasm, meaning that, they stop breathing. So it is a whole spectrum. What we are seeing is more of a side effects rather than, anaphylactic reaction.
Thank you, doctor. The next question is by Rajesh G. Patel. He asks, if you come in contact with somebody who told you that they came positive, after how many days?
I already answered the question. I already asked the question, so same thing. I'm sorry.
Okay, great. Let's move on. Rajesh G and Sunita G Shah ask, can the vaccines change your DNA?
No, we answered that. No, they don't change the DNA. Sure.
Okay. Next question. Will the vaccine work against the new strains?
Yes, the preliminary research has shown that both the vaccines, Pfizer and Moderna, is beneficial for the UK as well as the African strain. Yes.
The next question is again by Rajesh Ji and Sunita Ji Shah. Do we have to vaccinate every year like the flu vaccine?
Actually, that's a very good question, Rajesh Ji. I mean, I teach medical students, and this is what I'm going to say. The virus, all these viruses are smart. They're not here to die. They're here to live. So when we have this herd immunity, meaning when everyone takes the vaccine and everyone starts getting immunized, the virus will most likely get attenuated, meaning it becomes less virulent, less effective, but it's here to stay. Even though CDC and FDA has not ruled in on whether we will need it annually, we have to go back on our historical way, how the flu vaccine behaved 100 years ago and how it's present even till today. So we might have to be prepared for an annual kind of vaccine. But like as we see today, as we hear from CDC, they do not comment on whether and when we need a booster dose. But that's something that we might have to have an open mind and say that the virus is here to stay, but might be less virulent and much more attenuated kind of virus.
Thank you. The next question, Banuji asked, how will vaccine immunity last? How long will the vaccine immunity last?
So Banuji, we don't know yet. We do not know yet. Like I said, that's why CDC is actively collecting the data on the vaccination. We do not know yet. So as we speak today, there's even no guidelines of whether we should be receiving it come fall of 2021 or winter of 2021. We do not know yet. So very, very preliminary to say that it's going to last for long or we would need it more frequently.
Thank you. The next question is, what happens if you get COVID-19 after the first vaccine?
So no, I did address that. I think you don't, if you get after the first vaccine, again, the recommendation is to delay the second, because remember we talked about you have to be asymptomatic before you receive the vaccine. So if you're closer to the second dose and you unfortunately acquired COVID-19, then you have to be asymptomatic before you go for the following dose.
Okay, the next question is by Dr. Sadaji. If someone starts showing symptoms of COVID, should they get any treatment right away?
Absolutely. So the inclusion criteria for monoclonal antibody happens to be someone who is not hospitalized, who are not on oxygen, who's not on ventilator, but they do have mild symptoms such as cold, cough, they have fever. Please reach out to your primary care provider. They might, end up initiating various, again, EUA kind of treatment, which is available out there, or even connect with the healthcare system to arrange for the monoclonal antibody 1-dose infusion.
Thank you so much. We've answered all the questions placed in the chat. If anybody has any last minute questions, please ask right now.
I had a question, Rekhaji. When are teachers and college students will be on the list? I'm tired of my 16-year-old and 18-year-old being at home. When will they get to go to college?
So are they 16 and above? Teachers, they're part of that 1C that we talked about. I mean, definitely, yes, teachers are part of 1C. Unfortunately, it would be very political for me to comment on the vaccination rollout. So I'll keep my thoughts to myself. But once I think 1C is rolled out and when it's available for the public, and the kids are less than 16 or 18, less than 16, they cannot get Pfizer as we speak at, and less than 18, they cannot get Moderna. But teachers are part of the 1C, phase 1C.
Thank you.
Hello. I ask a
Can
question?
I say after?
Yes. I believe Rasik ji has been raising their hand for quite some time. Please ask your question.
Okay. Number one.
Yeah,
hi. First of all, I like to thank first of all, I like to thank all the three doctors. They did excellent performance. It was a very good web seminar, which was very helpful to all of us. I have a question, especially to Dr. Nilesh ji. Nilesh ji, your son has presented a very good guideline for the kids, but then there is we never talked anything about the vaccination under 16. Is it not necessary for the kids from 1 to 16 years old for the vaccinations? Is the vaccination is going to be available in future, or they are just they are immune to those virus? What is the story?
So, the reason why the vaccine was directed towards the elderly is because it's those people who are getting more sick. It is those people who have more comorbids, like that means more health conditions, more lung conditions, more heart conditions, that makes them more prone and higher chance to get sick. So the attention and the energy was directed towards the most vulnerable population. That's why the vaccines were first tested in the elderly and the middle-aged people, because that's the biggest benefit you're getting. The media has, I have seen the numbers, I don't have them offhand, but the percentage of children who get sick is very, very low. The percentage of children who have symptoms and who go to the hospital is even much, much lower. So what happens is, while we are talking of in adults or in the general population, out of 100 people, 2 getting very, very sick and kind of dying from the disease, in children, it's even much, much lower. And the concern was that the children would be spreading the disease very easily because they have no symptoms, and they're spreading it to their teachers and spreading it to their parents. And that was the original concept of shutting schools down. We have had a crunch of resources where we have to roll out billions of vaccines now all of a sudden. And India has really stepped up and has made, the previous administration actually pumped a lot of money into getting the Pfizer vaccine out in the market. So now that that initial concern and that wave is over, and we feel that in the next 3 to 6 months, a lot of the vaccines will be out, that first of all will protect the children by itself. Now there are studies already on the way for children. So yes, children are our priority, of course, but they don't get as sick. So the priority had to be shifted to the elderly people. So it's on the way. It's not that they've forgotten it, but it's the second priority. Now, keeping that in mind, we've had a shortage in vaccine. Even elderly people are having a trouble getting the vaccine. The new administration is trying to ramp up the vaccine. It's not easy to do the whole process because we are not designed to give millions of doses of vaccine within a few months. I mean, we ourselves have applied to the CDC for the vaccine almost a month ago, and we're waiting for the vaccine hopefully to be shipped to us, but we haven't heard back from them. So once it becomes available, I'll be more than happy to just reach out on this forum and inform everybody about it. But they have to do a lot of unconventional things to make this happen. We have channels of distributing flu vaccine every year, and we give almost 3,000 flu vaccines every year. Dr. Ramsarup in the office is giving 30, 40 vaccines every day for flu. But the system was not designed for a vaccine to be stored at minus 70 degrees, and that was the biggest limitation in distributing this vaccine right away, transporting it, distributing it, storing it. And then once we take the vaccine out from the box, you have to use it within 36 hours and you have to consume the whole thing, that entire. So there's a logistics issue. And I think we are rushing to do this very fast. So you have to realize it's not a perfect system, but give it some time. I think it should get much, much better.
Thank you. Our next question
Rekha ji, you like
is
to
for
share some...
iPhone.
Yes.
Oh, are you?
I have the
Yes.
question that my daughter took the vaccine last Saturday, and Monday she got the virus.
So let me answer that. So, like I said, vaccine does not cause a virus positivity. So it could have been that she was in that incubation period during that 5 to 7 days incubation period, that it has been an unfortunate coincidence that she converted positive, but I just want to burst the myth out there that it is not vaccine causing, because vaccine has no virus that we are injecting. Both the Pfizer and the Moderna, it's just blueprint of an of a protein.
So she has the before the virus?
Most likely she probably had virus as an incubation period, yes.
Okay, thank you, doctor. Thank you very much.
You're welcome.
Thank you.
I
have
believe
a question,
we have
doctor.
another question. Please,
Aruna.
it's from the iPhone. Please ask.
Okay. In number 1 and 2, is there any different power? Vaccine 1 and vaccine 2. Is there any different power between the
No,
vaccines?
both are very, very close to each other. So the only difference is with Pfizer, that is, I would call it as number 1. So first dose after Pfizer, you had around 50 to 55% who were positive, but after second dose, the response was around 95%. The second one, after the first dose, the positivity of antibody was around 80, and after second dose was around 94.1. So bottom line is no major difference. Both are equally good. Statistically, they're not significant. Both are equally good.
Thank you.
Thank you. The last 2 questions posed on the chat are, the first one is, what happens if you don't get your second vaccine?
So, I mean, obviously, when someone misses the second vaccine, their immunity or antibody response would be much more attenuated. The risk of having or getting infected with COVID-19 would be much higher than someone who has gone through the second doses, of course. Like I said, between the dose difference between the two. So I would say, it's like just going halfway through and not completing what you're supposed to do. So if you miss the second dose, the risk of having COVID-19 would be much higher than someone who's completed both the doses of vaccine.
Great, thank you. The last question is, how can I get the copy of Conquering the COVID Guide?
Conquering the
Yes,
COVID Guide. It should be on the CDC, the link which I have at the end.
It's on the website. I'm sorry, Rekaji. It's on the website. If you were to just Google in, you probably should not Google it. Just type in the bar, nextgenguides.org. It's in short for next generation. So nextgenguides.org, and it's available. If you really need it, I could even email you a copy. You can just put your email in this chat box and I can forward a copy to you.
Dr. Mehta, can you also put the link in the chat?
Absolutely.
Right now? Great.
You'll have to put this email into your, on the top, rather than put it in a Google search. You just copy and paste it into your title bar in the URL. Quick question, Rekaji. So I think Rajiv ji wants to know that with all the vaccines coming out, when can we have a next JITO session face-to-face without a mask? Right, Rajiv ji?
I think it extends beyond JITO, all family functions and friends, etc.
So let me quote Dr. Fauci on this, right? I mean, so he even dashed down the current president's expectation of when the schools. He said that 100 days, possibly no. So I would say safely, if I have to be very subjective, my view, I would say safely 2022, early 2022.
Thank you. One last question. Rajni ji asks, how can you travel overseas? And if you're vaccinated, does that allow you to travel?
Vaccination protects oneself. However, the precautions which I think Nilesh ji spoke about, and the testing does not require, testing requirement from Dr. Swaroop's presentation does not change. So you still have to wear the mask. You still have to, in public, some people have to continue to have your hand washing, social distancing, etc. That should not change at all, and that the guidelines does not change from that perspective at all. So it's just that you're protecting yourself, but people around you might still have the infection.
Thank you. Well, we've reached the end of our COVID-19 webinar. As we all know, COVID-19 will be around for a while. Accepting our new reality, being informed, and making smart choices to protect our family and the communities around us is the only way we will stay healthy and safe. On behalf of JITO USA New York Women's Forum, I thank the 3 panelists for their valuable time and ask the audience to applaud their selfless duty to help all in need. I also thank all of you for attending today. We hope to continue to provide you many forums on relevant and pressing issues. Now, Ms. Prabha Golia, the chairperson of JITO USA. Well, we've reached the end of our COVID-19 webinar. As you all know, as you all know, COVID-19 will be around for a while. Accepting our new reality, being informed, and making smart choices to protect our family and the communities around us is the only way we will stay healthy and safe. On behalf of JITO USA New York Women's Forum, I thank the panelists for their valuable time, and I ask the audience to applaud their selfless duty to help all in need. I also thank you all for attending today. We hope to continue to provide you many forums on relevant and pressing issues. Now, Mrs. Prabha Golia, the chairperson of JITO USA New York Women's Forum, will be concluding this webinar.
Thank you so much for attending the health seminar. I hope this was informative and helpful. Thank you to all the doctors who were able to spend time today with us. I especially wanted to thank Rajivji and his entire JITO team for making this possible so quickly. Kalpanaji has been a cheerleader for our community, and we cannot be thankful enough to her. Thank you, Ruchiji, to run this program so smoothly. If there are any questions, don't hesitate to call. Thank you, everyone. Jai Jinendra. Thank you.
Thank you, everybody. Jai Jindra. We'll also send a recording to all the people on the JITO mailing list and those that have registered in the next few days.
Thank you.
Thank you.
Thank you.